My name is Esther, and I'm planning to I will be your nurse this evening, and I want to perform the hand hygiene, and then I will apply a tourniquet on you so that I can access for the IV line. I will go ahead and give you some medication for the infection that you're having, and then I'm going to do an IV push for the furosemide medication. So I am going to perform a hand hygiene. And as I perform the hand hygiene, I just wanted to ask you if you're aware of any allergies. And I also want to ask, what is your name and what is your date of birth? Right. Your name is John Smith, and when is your date of birth? Your date of birth is April 6, 1981. Let me get the right kind of gloves here. The size that is going to fit me so that I can be able to put in what I need to put in. And you have already confirmed that your name is John Smith and your date of birth, according to what I have, is correct. And before I go ahead, I want to ask you if you know of any allergies that you have. Do you have any allergies to any kind of medication? No? No allergies? Do you have any allergies for any gloves or anything? No. So what I'm going to do the gathering of supplies here. And the gathering of supplies is already done. And now that it's already done, I am going to go ahead and prepare the IV fluids that I have. I have the lactated ringers, 1,000 ml. And I also do have, first of all, I will get your hand ready. And so what I'm going to do, I'm going to first of all do the hand hygiene. And then after that, I am going to apply a tourniquet so that I can be able to get the right kind of vein. I am going to apply the tourniquet, and then I'm going to do the palpation of the vein so I can be able to get what I need to get. And there you go. I am going to remove the tourniquet, and I'm going to cleanse the area with the chlorhexidine. And as I cleanse the area with the chlorhexidine, I am going to give a little wait of 30 seconds so it can be able to dry. I want it to dry on its own. And as it dries on its own, I'm gonna give it a 30-second wait. The equipment is already set up. And so I'm going to go ahead again and apply the tourniquet. And then as I apply the tourniquet, I am going to do the venipuncture. And as I do the venipuncture, you're going to feel a needle come through. You're going to feel a needle come through. a minute. Okay, there you go. You're going to feel a needle come through. And I am going to see if there is some blood that is going to come up. And I am going to make sure that I do a saline lock. And as I do the saline lock, I'm going to first of all wipe. And as I wipe on it and I'm gonna do a saline lock. And I'm going to push this normal saline and to make sure that that one is okay. And then I am going to connect these. Take out the tourniquet. I am going to connect it. Look, and then what I'm going to do, I am going to apply this one so that you can be able to see it. And what I'm going to do, I am going to put the name. I'm going to put the name, the initials for me. Initials have been placed. This is EM, and the date today is September the 11th. And so after that, the tourniquet has already been released. And after the release of the tourniquet, I'm going to do the dressing. It's already applied. And so what I'm going to do, I'm going to remove the gloves. I will do the hand hygiene. The hand hygiene is done. And then I am going to take away all the supplies that I used. And I am going to trash them away. And then after that, I am going to program the pump and make sure that it has the items that are needed, that are ordered by your doctor. And so I'm going to select the channel. I'm going to make sure that the pump is on. Then select the channel. And so what I need, according to the order here, the doctor says the lactated ringer, I have the order here with me, and the order says the lactated ringer is supposed to go in at 75 milligrams. And so that is what I'm going to do. The lactated ringer is at 75 ml per hour. And so I need to program that at 75 according to the order. And it is going to go for 75 mils per hour. And then I'm going to take the medication that is ordered. That is the levofloxacin that is going to go at 500 mg for 100 mils. And so that is what I'm going to hook. And so I will put on some gloves so that I can be able to apply all I needed. And before I give the medication, I am going to make sure that I have the right medication. And you, John Smith, do you confirm that? And then the time that is supposed to be done is at 5, so that is the right time. And I also want to let you know that I am going to compare the MAR, which is here, and the medication is the lactated ringers at 75 ml, and that one is correct here according to my MAR. And then I'm going to do the level of Fraxazine 500 mg at 100 ml. That is correct. And so what I'm going to do, I'm just going to hang on the medication now because I have already confirmed. And so what I'm going to do, as per the order is right, the time is right, you're the person supposed to receive it, the time is right, and as I have put the pump in, that particular medication is supposed to go in as the order. I have confirmed the order, and I have confirmed that you're the right person. So what I'm going to do, I am just going to hang in the medication, and before I do that, I'm going to wipe on here just to make sure that this is the right thing. And I am going to go ahead and connect the medication. Connect the medication. And I will wait on the first of all, let me connect it before I wait on pressing on the right flow. Just to make sure that that goes in tight and no medication is leaking. And then I'm going to do the hanging on here so that this one goes above that. And so that one, I'm going to hook it over there. And then I'm going to open up this so that I make sure the drops go through. And that the drops here are going in